Okay, we're live.
Okay. Welcome, compassionate friends from around the globe, to the Charter for Compassion's first Compassionate Communities webinar of 2021. I'm Pam Lewis, and I'm the chair of Compassionate Houston, and I'm thrilled to be participating today in this webinar, and thank Marilyn and Mimi for inviting me. I would have been thrilled to do it. I am thrilled to do it under any circumstances, but learning that the Charter for Compassion Pakistan was involved and that we share the same 10th anniversary next month of our founding made me even more excited about this prospect. So I just wanted to say that the Charter for Compassion has been doing these webinars with representatives from the 400 plus compassionate communities around the world in an effort for all of us to be able to hear one another's stories and share the ways that we're providing compassionate service and action. And they're all recorded and they're placed on the Charter's website after they take place. And you can go there and watch past ones as well as this one today. Just in terms of some of the housekeeping duties, if you would place your questions for today's presenters into chat at the end of the presentation, we'll share those with them, and they're happy to answer and discuss all of those. And also, I believe that their websites and contact information will also be in the chat so that we can reach out as we wish later about areas of common interest and concern. And with that information, I would very much just like to introduce today's presenters from the Charter for Compassion Pakistan. And they are Mr. Amin Hashwani, the president of the Charter for Compassion Pakistan, and Ms. Zureen Qureshi, the executive director of the Charter for Compassion Pakistan. So if you are ready, please go ahead and begin your presentation.
Okay, hi. Hello, everyone. Good morning. It's evening over here. So Zareen, will you start off with the brief video? Can you start with the video, please?
Yes.
So this video we had made many years ago at the initial phase. Zareen, there's no sound. Okay, I think the sound may problem. Okay. right. So let me just start. I'll start with a brief introduction. Can you guys hear me? Yeah. Okay. So a very brief introduction on why we did what we did. So I'll give a very brief introduction, and then my colleague Zareen will speak about what exactly we're doing. So when this Charter for Compassion, the idea originally came, Karen and I, we like met up, and we were like scratching our head of how do we take this very elusive idea of compassion and how do we fit into our modern day society. And I think it was the genius of Karen to have thought of this whole idea of Charter for Compassion as part of the TED Prize, because at the time, there really wasn't a sense of urgency at that time. People were going about and they said, "Oh, it looks nice and everything," but her idea was that it is absolutely imperative that we live in this modern day society, and we're living in these outdated systems um, uh, that are outdated. So Karen Armstrong, she came up with this whole idea that we need to go back to our roots in order to reclaim our future. And hence we need there's a crying need for compassion in our society, because if we do not, over a course of time we will come to a point where we have an unviable world for us to live in if we do not adopt these old, if we don't go back to our roots. So hence this whole idea. And then Pakistan was one of the first places where we implemented Charter for Compassion. For 2 years, we went through this phase of trial and error to see what works, what doesn't work. Meanwhile, Karen Armstrong, she wrote her book, 12 Steps to a Compassionate Life. That was primarily to show a path that how do we take compassion and how we make it part of our daily lives. So Pakistan was one of the earlier cases where we implemented Charter for Compassion. Uh, the key was we had to come up with a value proposition. We all would agree, no one would disagree that compassion is not good. Yes, it is good, and so are so many other things in life. Yet we fail quite miserably to implement that. So we needed to tie in with a strong value proposition and to make it systemic in our system. So hence we had compassionate school, we looked at compassionate businesses, look at compassionate religious spaces. We came up with a charter for compassion, and the book. So these were the toolkits that allow it to be implemented. And Pakistan, I'll just tell you very briefly before Zareen takes over, is that in our schools, so Charter for Compassion Pakistan, we run schools, we run women empowerment centers, we look at compassion, we've dabbled with compassionate sports, compassionate environment, a lot of these things. So we never view ourselves as just an education institution or a women empowerment initiative. The key that differentiates us from the other NGOs is we bring compassion, this idea of compassion, into each and every aspect of our community engagements. So and there is a strong value proposition over here, and this I want to overemphasize, that let's say educational skills combined with life skills, compassionate skills, uh, has a multiplying effect. And so if you impart, let's say, compassionate skills in women empowerment centers, the outcomes are far more significant, even in schools. And this is what in Pakistan we have tried to like demonstrate, so that there is a strong value proposition, even if you don't care about compassion and you just care about profitability or just looking at the so that in itself, there is a strong, and that is how we felt that we could sustain this like initiative. So it's not about we feeling good about ourselves or just something good to do, so we feel less guilty. there is a strong value proposition, and this is what differentiates us in a lot of as compared to other NGOs. So with that, Zareen, I would like you to, if you can just speak about what we do in CFC Pakistan.
Hi guys. So as Amin Saab mentioned, that we have different projects that are focusing on not just compassion but other aspects of life and other projects as well. So we have compassionate schools, we have women empowerment projects, which is Mumkin. We have compassionate healthcare project, which is focusing on hospitals. We have compassionate communities, which is not only focusing on schools, but is also focusing on parents as well. Because when you talk about compassion, we want an environment to be focused on compassion. So the environment is not just for school, for homes as well. Then we have compassionate sports, because research also suggests that sports is one medium which attracts a lot of audience, which attracts children very easily. So we integrated 9 skills of compassion that Amin Saab just spoke about. If you can see my screen, these are the 9 skills of compassion. For 2 years, we were busy in research and development, as Amin Saab mentioned. And we wanted to create a project, and we wanted to create an initiative which would focus on the tangibility of compassion. Because whenever you talk about compassion, people usually associate it with a skill which is not important, or usually associated with a religion. We wanted them to understand that compassion changes mindsets. It's a household name. It's something that changes your lifestyle. It's something that changes your personality. By the help of a book called 12 Steps to a Compassionate Life by Karen Armstrong, I would like to mention that Karen Armstrong is a religious historian. She has written a lot of books on different religion. She's done a lot of research. She came to Pakistan and she wrote a letter to Pakistan as well. The book called 12 Steps to a Compassionate Life, which is basically, you can call it the Bible for Charter for Compassion. We came up with 9 compassionate skills. If you can look at my screen, these are the 9 compassionate skills that we focus on. Starting off with the very first project called Compassionate School Network. We started working with privileged schools. Initially, we wanted it to be a trickle-down effect, and the focus was on a compassionate leadership. But with the passage of time and with understanding what compassionate skills are, how can they impact, we started working with marginalized communities as well and underserved schools as well. At the moment, we have around 150 schools in private schools, which are partnering schools. So with private schools, partnering schools are those schools where the management is not ours. The management is by different institutions. We work them, we train teachers, we train students, we do small activities. So at the moment, starting off with 2013, the execution, we impacted around 72,000 students in 150 schools. Then we came up with compassionate schools. These are the schools which are adopted by Charter for Compassion Pakistan under public-private partnership, under private schools management, under different organizations. At the moment, we have 34 schools with 22,000 students. What is unique about these schools are, we have non-formal centers as well. We have 7 centers which have children studying, out of school children studying. They did not have a chance to go to school. So these children, the ages are from 10 to 14 and 14 to 16. So these children come to our centers, they study, and they also learn about 9 compassionate skills. So what is unique about all these programs is we wanted to create a compassionate, conducive learning environment where the focus is not just the studies, which is not just the syllabus, it is the 9 compassionate skills as well. We created lesson plans which are unique, which are focusing on 9 compassionate skills, starting off class 1 to class 10. We provide conducive learning environment, improve to access to quality education, which was the main reason for adopting these public-private partnership government schools, which are in far-flung areas. We were able to improve the governance. We were able to digitalize the syllabus. All these impactful changes we were able to do in the span of 5 years. It took us a lot of time to do a lot of research, how to integrate all these things. After which we created these projects. At the moment, we recently took over one of the another 8 schools model, which is a cluster school model in one of the far-flung areas of Sindh, which is the largest province of. We have small activities which are focusing on. So the idea is that the teachers get trainings on 9 compassionate skills. It's a very long training that they go through with. Then they are given lesson plans which are focused on 9 compassionate skills. And then apart from that, they have small activities which are focusing on compassion. So we have peace arts competition, we have peace walls competition, we have unsung heroes where students write stories, we have story writing competitions, we have arts competitions. So all these you can say we are taking a holistic approach towards compassion, towards making them understand what compassion is all about. How can they change mindsets? The other project that we came up with is a women empowerment initiative called Mumkin. Mumkin is an Urdu word which means possible. Everything and anything is possible for the women of for today's women. What we do is we have different vocational centers around in the country, which are focusing on not just vocational trainings. They are also focusing on compassionate skills, because we believe compassionate mothers will become compassionate professionals and better professionals. We're focusing on entrepreneurial skills, and we're also focusing on financial skills. So these are the three financial skills that we focus on. We teach them dressmaking, we teach them office management skills, we teach them beautician. So the beauty of these skills, of these vocational training skills and their curriculum, is that they have 9 compassionate skills integrated to them. So if you want to learn about dressmaking, they're also learning about mindfulness. If you're learning about computer skills, they're also learning about forgiveness. So this is a unique mechanism that we've come up, Charter for Compassion Pakistan have come up with. It took a lot of time for us to start the execution, and now, alhamdulillah, we're in the midst of this. We have 1,800 trainees which have passed out already. We have 95% successful rate, out of which 500 are entrepreneurs. They're earning on their own. They have started their own small businesses. They're earning around 25,000 to 35,000 rupees a month, which is basically uplifting their economic and their conditions, house conditions as well. We have 2 unique employment centers. What we do is we also provide them an opportunity that we take orders from big organizations, such as big organization, and these females are then given a call that if they want to come and work in our center, they want to utilize the facility, they can come and they can utilize the center. It's a win-win situation. We want them to understand that the facility is not just for them to get training, but for a holistic approach. Again, coming back to the point. I'm just going to show a small video which was made 2 years back, focusing on Mumkin.
Zareen, in the last video, the sound wasn't so good. So if it's not working, we'll cut it short. Okay.
Okay.
So we can leave some time for Q&A. Is the sound coming okay, Zareen?
Yes.
Yeah. Okay. Zareen, sound is not coming. I suggest you can, close the video and explain it verbally. That might be more effective.
These are different case
You
studies
can pause it.
we wanted to
Maybe,
focus on.
so Zareen, maybe if you can explain what the video was about and the
So
kind of
basically, these
impact
are
that this
different
child had.
success stories where we have females from 3 different areas, and they are sharing their experience as far as Mumkin is concerned. Why was Mumkin created? We used to go into underserved areas, marginalized areas. We used to train teachers over there on compassionate skills. They were very curious most of the time that the clothes we wear, they were able to get the clothes, but they did not know how to do the stitching. They wanted to wear modern clothes. They wanted to also learn about, because we were very much tech savvy. Whenever there was a problem as far as computer is concerned, we used to open the computer. We were able to do it. So they were very fascinated as far as the women is concerned, and they were like, if you can do it, why can't we? Under that, taking care of that feeling, we started doing a survey that if we start training you on all these compassionate skills and the vocational skills, would you be interested? We got a lot of we got the 95% of positive response, and we started creating these vocational centers within communities. What is unique is they don't have to get out of their community, because there are at times cultural problems, there are at times other issues due to which they cannot get out of their areas, which we can totally understand. Every area has its own dynamics, its own demographics, and we need to respect that. Because of that, we started creating compassionate vocational centers, Mumkin centers within communities, after which we were able to also have collaboration with different organizations. And then the number started growing. All these females, they started coming to the center. A lot of females who were not allowed to come get out of their houses were able to come to these centers because they were they were in the communities. So these are basically sharing some of the success stories of people. It's a detailed video. You can visit our Facebook page, and you can also see these videos over there, just in case if you want to have a look at it again. I'm going to go to the next slide, which is basically talking about our other projects. One of the main projects that I would also focus on is Compassion Healthcare. It's a recently started initiative, which is unique in the perspective that it is focusing on compassionate leaderships within hospitals. When you talk about doctors, when you talk about nurses, their profession is very, very difficult. Every day they face new challenges. They get burnout very easily, which also affects their behavior. This whole project is focusing on changing their behavior, not just for the patients, but for themselves at the end of the day as well. In this particular program, we collaborated with Aga Khan University Children's Hospital. We trained the nurses in 9 compassionate skills. We created scales. We focus on the human resource management as far as compassionate skills are concerned. All the 9 skills were added to their review sessions. We saw a huge difference in their personality. We saw a huge difference in their behavior. It was not just us, but the patients were also giving feedback. The training impacted their lives. The training impacted the lives of the patients and the performance of these individuals who went through the detailed training. It was not, again, coming back to the point, it was not just a one-off training. It's a perpetual process when we talk about behavior change. This program went beyond its limits, and we worked with World Bank. We collaborated with World Bank, and we trained lady health workers in 9 compassionate skills. Again, their professional is one of the toughest professions in the world, where they have to go within communities. They have to convince people on doing certain things. They have to convince mothers how to take care of their children. When they learned about 9 compassionate skills, which basically integrated with early childhood development, they were able to do new things. They were able to focus on themselves. They were able to focus on their patients. Mothers understood early childhood in a better way. All these documents and all these surveys were done by World Bank, and they're available on the website as well. So the behavior change affected the personality of all the people involved in this particular project. The next project that I would be focused on is called Compassionate Sports, where we did not just train children on one of the sports, which is cricket, which is very, very popular. Cricket is very popular in Pakistan. We use cricket as a medium where we integrated 4 compassionate skills: mindfulness, courage, forgiveness, which did not just make them better cricketers, but also better professionals. we saw a drastic change. This is one of the projects which saw change drastically and very quickly. So we had 1,500 children coming to these camps learning about cricket. We had coaches who learned about 4 skills of compassion, and while training, they were able to also teach the students 4 compassionate skills. This is one project which had drastic results, which is one project which had quick results. So we're also going into other sports such as football, which with females. Very soon we will be launching that particular program. Collaborative libraries project was launched after we started going into underserved schools, where we came to know that there are the idea of library did not existed before. So if I show you a picture, this is a library that we created in an underserved school. The idea was to bridge the gap between underserved and privileged schools. We, as Charter for Compassion Pakistan, with partnership with different corporate organizations, provided them the library, the infrastructure, while the privileged schools were responsible for going over there and doing different activities. This increased the confidence level in students of underserved schools. This increased their language skills. This increased their comprehension skills. And above all, they have a library now in their school. Compassionate Footprint is focusing on making people understand the importance of environment. And environment, I would like to quote unquote, the environment of not just the environment. We talk about plants, we talk about mountains, I'm talking about the environment of the classroom as well. Every kind of environment we sit in, we breathe in. This particular project focuses on that. Compassion Business Quotient is another project which is focusing on the leadership, compassionate leadership. It is focused on corporate organizations where we work with managers, upper management and middle management, focusing on the 9 compassionate skills, training people on 9 compassionate skills so that they can, again, become better professionals, not for the product development as well, for themselves as well. So the future project that we will be focusing on is Bridges. This particular program was launched a year back by Karen Armstrong. It was inaugurated when she visited Pakistan for our 5th anniversary. This particular project was created. So this is a unique project where we have taken spaces under bridges. There's a lot of space which is usually taken by druggies, which is not utilized. CFC collaborated with a lot of corporate organizations. They created this space. This space will be utilized as a community corner where communities will be allowed to come. They can use this space for their recreational activities. We have a sports ground in this place, so they can use this space for sports activities as well. And we will be creating a vocational center over here, and we will also be creating a school which will be for out of school children. Another program that we will have launched recently under Compassionate Healthcare is called Rubaru. It's a mental health initiative program which is focusing on mental well-being. Rubaru is an Urdu word which means face-to-face. It's an online platform which focuses on providing therapy sessions, online doctor's appointment for people who are concerned about their mental health. It also is going to grow and will have a call center where people can call and have appointments with mental health professionals and therapists. I believe last program that I would like to talk about is called Razakar. Razakar is an Urdu word which means volunteer in English, promoting altruism, yet another skill that we have. The idea is to create a consortium of volunteers. Whoever is interested in working with us, helping us expand our program, helping us expand the message, they can apply at Razakar. The forms are available online. So we have a lot of volunteers online working with us online at the moment due to the pandemic. Once this is inshallah over, they will be working with us in schools. They will be working with us for different projects. I would like to focus on advocacy now. So Pakistan, Charter for Compassion Pakistan has also been involved with Government of Pakistan, Sindh government, as far as advocacy is concerned. We worked for girls' education. Initially, what happened, like when we started taking over the schools in interior Sindh, we saw a lot of dropouts, girls drop out in schools. So the main reason was the fee, which was for Higher Education Commission fee. We went to the government, we submitted a lot of petitions. The fee was decreased after that. After 2 years of struggle, the fee was decreased, but not just for girls, for all boys as well. So now the enrollment has increased. We've also started working with STEFTA, which is Sindh Technical Education Vocational Training Association, when we are creating a public-private partnership node in their and capacity building for them. What else we've done is we've created a unique, first of a kind, compassionate lesson plan curriculum, which is focusing on not just 9 compassionate skills. It is also focusing on all the subjects that the government is teaching at the moment, which any government school can adopt. We are also involved with Sindh government for creation of content for their for content as far as curriculum is concerned, as far as syllabus is concerned. So CFC is one of the largest partners for education improvement in Sindh. So that brings us to the end of this presentation. If you guys have any questions, you can ask us, or we can have a discussion as well. Thank you.
Any questions? How big is your team, Zareen? The question is.
So we have, so there are different teams that we have. We have 650 people working with us right now, which is, we have some government people also working with us. So we have a head office in Karachi with the 45 people, which is growing every day. And the rest of the team sits in regional offices, wherever we have these projects execution happening. So we have these regional teams sitting. So around total 650 people we have in our team.
Okay, let me just take this other question, that is your funding and sustainability. And I need to give a little long-winded answer. This is not it. When we founded it, it wasn't just a typical NGO as such. We look at innovation, because generally NGOs are risk averse. So if one looks at, either it is donor driven, where the tail is wagging the dog, or if it is, if it is, let's say, zakat or charitable money, people are scared to take any risk, because if we feel we are custodians of the money, and if we take any risk, if we fail, we'll be letting down a donor. So there is a moral issue also here. So we have a component where, I kind of encourage people to take risk and fail. And that, I think, it's absolutely important, not only in Pakistan, but everywhere around the world in the development sector, because we have limited resources, and the challenge on the ground, be it health, education, or any other issue we look at it, it's overwhelming, to say the least, and the resources that are allocated are limited. So if you do not have innovation, and innovation means risk and failure, you will not be able to do a disproportionate impact on the ground. So hence, if you see a lot of the programs we do is all, we think about it, we come up with some of these crazy ideas, we experiment with it, and some of them work and some of them do not work as well. So there are many other projects which we do. So we have this like a Silicon Valley model in the development sector, and we keep on innovating. One component in that is also about sustainability. So for example, we have seed money, which is there. We are building an endowment. We work with government under public-private partnership. We work with corporate sector, where we give them, a lot of, value for the employees. And we work with international donors as well. So it's a combination of various things that we do. That is how we create the sustainability. So I'm then, Zareen, there are other questions. If you've seen, maybe you can have a go at that.
Yes. So you've answered the funding question. Are you active only in Sindh or also in other provinces? So yes, we are at the moment active in Sindh. So we have projects being executed in Sindh, but we're in talks with Balochistan government, and we're also in talks with other governments in order to establish the same projects in other provinces. Due to the pandemic, a lot of things got delayed, but yes, we will be very soon in other provinces as well. I hope that answered the question. Next is, where do you think you will be in the next few years? Will there be new projects? There might be activities, but basically we have programs, and then the programs are focusing on projects. So under education, we have compassionate schools under initiative as far as economic empowerment is concerned. So Mumkin started as a women empowerment initiative. Now it has men training as well. So every project is growing on its own with having innovation into it. So yes, we will be growing with projects, not with programs, because the thematic areas would be same. These thematic areas came up by the help of a Gallup survey, a detailed survey that we did in Karachi under the Compassionate Karachi initiative, which was a copy, or you can say which was a local initiative under the Compassionate Cities campaign. What made it different was we went to the people of Karachi with a detailed survey that how do you want to see Karachi in the next 5 years. We received around 400,000 visions, which focus on all these thematic areas, after which we started creating projects under these thematic areas. So I hope this answered the question. So there's another question which is very interesting, saying, can you give us some metric examples that you are most proud of? So there are two, which I'm very proud of. One is for Mumkin, the Women Empowerment Initiative. We started off with 90 females in the first year, out of which 80 were able to change their jobs. The survey also suggests, and the information was also taken, they saw a lot of change in their personality and decision making. So from not just becoming a homemaker, they started taking decision for their children, they started investing on their children, they started investing on other things, on other aspects of their life as well. 2 years back, we were 90, and at the moment, we're standing around on 1,800 females trained. 85% of them have their own jobs. Most of them have their own small businesses, promoting socioeconomic, and also we've seen a rise in decision making, a rise in their involvement as far as their home is concerned. Their husbands have started taking their consent whenever it comes to their children. So yes, that is one. The other one that I spoke about was the sports. There's another question I would like to answer also with the same question, is like, why do you think the sports sector took so quickly and observably to the compassion ideals? Amisa, would you like to answer this question, or you want me to continue?
No, I think Zareen, you're doing absolutely fine. I'll put some comments towards the end, but you please continue.
So we saw a drastic change with sports is because children get attracted to something which is not at times related to the academia. So that is why I believe sports is another medium that attracted their attention. While training them, for example, if they were learning how to throw a ball, they were also learning how to throw a ball mindfully. Sportsman spirit was taught to them by the help of forgiving the other party if they did something wrong, or if they won. So you have to accept the other party that they're winning, and there you need to accept their win. At times they accept your win. So this is how I believe we saw a lot of change, and that is another project that we saw a huge, positive change as far as children were concerned within the span of 4 months. That was huge. So I'll give you another example.
So Zareen, on sports, you can talk about how the coaches would train the kids, and then the communities within these underserved areas.
Yeah, so we started off working in one of the marginalized communities, and initially when we created the ground, it used to get vandalized. People used to come because there were a lot of, according to them, they don't want their children coming over here wasting their time. We spoke to them, we did some advocacy, and then they stopped vandalizing the whole ground. But there was this one kid who kept on doing that, and we came to know that why was he doing that? Because he used to go over there and play football, and we started teaching cricket. We've sat with that kid, with that one particular kid, and we did some counseling. We made him understand that why is this ground important for everyone, and this is not just cricket, it's for everyone. That one particular kid was later on became one of the success stories that we have. He became one of the coaches, and he started teaching 4 skills of compassion through sports. So I believe we have a lot of success stories with sports. If you can send us an email, or you can go on our website, you can see more details on that. I hope this answered the question. If not, you can ask me again because I believe the panel is on.
So Zareen, there are a few more questions on the list.
Yes,
If you can just have
yes.
a look at them.
Can you show the 9 values of compassion slide again? I'd like to take a photo. They are available on our website as well. You can go to charterforcompassion.org.pk and you can see these 9 compassionate skills. These are locally developed logos for these 9 compassionate skills, and they were taken from 12 Step to a Compassionate Life. Here you go. Okay, so Anjali saying was so encouraging to see all the CFC Pakistan has been doing. I would like to ask what has been the biggest challenge which you feel you have faced? Oh, okay. So the
Zareen,
biggest challenge.
let me
Okay.
do that. This one. Look, changing human behavior is a huge task, and we feel that at an intellectual level, if we read a book or see a video or see a story, we get inspired. We think, yeah, gee, this looks good, and we should do it. It's a good thing to do. However, for us to sink into it, into us at an emotive level and eventually change our DNA is very, very difficult. And that is where the real challenge comes to change human behavior. So one-off school activities is fine. It makes us feel good. However, it's for a long, long time. Number one. Number two, we look at teacher training programs. We will look at lesson plans. We would look at school activities. We have compassionate boards. So we have to take a more holistic approach. Only and only with that do we get lasting results. So if you do an intervention for 1 month, 2 months, everyone goes thumbs up. But after 6 months, when you will visit, we would normally be back to our own behavior and etc. So I think human behavior change takes a long time, and one has to be thick skinned to face those challenges. Another aspect is to listen. We have to take a bottom up approach. We have to listen to those people. Each society has their own nuances. Each sector of intervention has their own challenges, their own mindsets, their own paranoia. So we need to listen to them, and hence we can. That is how we will do it. The last thing I just want to say is that any problem. Why this is so essential is that if you look at almost all the problems of our as a global society, the root cause is societal. If you look at conflicts, you look at income inequality, you look at environmental issues, until and as you don't bring about a societal change, and that means bringing a change in our belief systems, in our behavior, we will really not be able to change, bring about meaningful impact. So the root cause is actually changing our mindset at a societal level, individually as well as collectively, and therein lies the solution. Everything else, inequality, environment, is a consequence of our uncompassionate beliefs, uncompassionate thought process, uncompassionate action. So that is where our core of our inspiration comes in, that if we really want to change this world, we have to change it at a society level. And I think Charter for Compassion is an outstanding initiative that can really bring about that change which we all look forward to.
So the next question is, could you share 4 compassionate skills which we were focusing on sports? In sports were forgiveness, courage, mindfulness, and self-compassion.
Zareen, can you also say in school how you do it on a step-by-step basis, class 1, certain skills?
Okay, so in class, so these 9 skills are basically divided into a scale. So in class 1, we talk about, or we teach them about courage and compassion. In class 2, we talk about forgiveness. So it's basically a process. We keep on adding 2 skills, and we keep on recollection of the first 2 skills. So in class 2, the students are learning about 4 skills. In class 3, 2 more addition of the skills. So when they come to class 5, they're learning about mindfulness and self-compassion, because these are a little bit, I would say, a little difficult for them to understand. So that is why their mindset needs to be there in order for them to understand. So that is why it's a perpetual process. Till class 8, all the 9 skills finish, and class 9 and 10, they have small projects to execute in order to show altruism. So this is how these 9 compassionate skills are being taught in school. So it's a 10-year process. It's not a 1 year or a 2 year process.
Okay.
So the next question is, yes, we can share the content of the presentation. What you can do is you can visit our website, you can visit our Facebook page. All this is available and more is available there. We have not shared a lot of details, but you can go on the website and you can see, and you can always email us on info@charterforcompassion.org.pk. So the only difference between the international website and the and Pakistan's website is .org.pk at the end.
Yeah, and also we would be more than happy to share our experiences, our content, collaborate with other stakeholders through the CFC Global platform. We would be more than happy to share whatever anyone would like to, and we'd be more than happy to like collaborate. If anyone is interested to work with us, we would be more than happy to do that. And because
need a lot of manpower always.
Globally there are some outstanding initiatives that are being done on compassion. So we would like to learn and collaborate as well.
So the next question is, how can we compassionate skills can teach play therapy? Yes, it does. We recently started training our teachers on play therapy, starting off with ECE. It's a very detailed, I would say, process. What you can do is, Nabila, you can email me and I will connect you with the academic department and the Rubru department who are responsible for executing this particular program in schools, and you can have more details. So you can, again, info@charterforcompassion.org.pk is the email address.
If there are not any other questions, I wonder, Zareen and Amin, if there are any final comments you would like to share with.
There is one, I'm so sorry, there's one more question.
Oh, is there? Okay.
Okay, I'm inspired by, so this is by Susan, and she's saying, how do you see Compassionate Pakistan going in the next 5 to 10 years? What are the future plans? Going into different areas with all the projects, executing more projects, and changing mindsets, I would say. This is something that we cannot give a definite answer for, because when you talk about, again, compassion, it's a skill, and it takes time for people to understand. At times, it's you understand it in an instant. Again, if it's about numbers, how many projects we'll be growing, I can give you a number. As far as Compassionate Pakistan is concerned, I believe, again, it's a perpetual process. It will keep, and it needs to keep on growing in order to be there, in order to sustain. So in the next 5 or 10 years, where would we see CFC Pakistan? We would want to see it all over Pakistan.
So let me give. I come from the corporate sector. I'm by definition a capitalist as far as my occupationally. When we started off these projects, there was no grand vision. To be honest, we developed content and we went forwards a step. As the Chinese say, crossing the river by feeling the pebbles underneath your feet. So we kept on tweaking our models. We kept on looking for opportunities, and as they came about, so all we had was a clear direction in which we will go, but we always kept our options open, and we were opportunists as well, and to see how, and we kept on learning and we kept on listening, and that is how we kind of went forward. So numerically, right now we have about 30,000. That's about 50,000 students. In the women empowerment centers, we have 4 or 5. Zareen, we have 5 or 4 women empowerment
We have
centers.
4 at the moment, and in the next, I believe, 2 months, we'll be going for 8.
For 8. So we will be numerically, we will be increasing. However, qualitatively, it is a lot of hard work. And, it really takes, so we have these good-hearted suckers that are perpetually on steroids, working, really putting the heart and soul into it. It is difficult work, and it takes its toll. So, but the org culture which we have tried to inculcate is, that we really have to roll up our sleeves and really work hard and really try to serve people. We do it with people. We get people who want to serve the communities. And this is what I always tell anyone who's joining the organization. Your first obligation is to the people on the ground. You are not coming here to just, out of guilt or creating a career. Your key is first the customers on the ground, then the organization, and then if there are any donors. So hence, whatever we commit, generally we far exceed. If it is a donor engagement, we always far exceed whatever our commitments are. So that is the org culture, and it's not easy.
There are some more comments, I think, here. I don't see questions, but I'm seeing very many comments about what a fabulous presentation this is and how amazing your work is. And I think you couldn't have been more inspiring, and your passion is so clear and comes through so well. I know I speak for many people to say that when you talk about hard work, you're personifying it in what you've done for the last 10 or more years. So
7.
Congratulations to you.
Thank
And
you.
I also want to add that in the chat, there is I think your website and ways of contacting you has been added a little bit earlier. And for anyone who isn't familiar, you can save the chat by going to the little 3 dots where you would write and clicking on that and save chat, which I know I'll be doing, and I hope others are too. Are there any final comments or final questions before we close today?
There's one new message.
Okay, thank you. No, I think I just want to like thank everyone for organizing these things, and I think this is a really good format for us to learn from each other. Being on the CFC board, I'm aware of all the fantastic champions all around the world that Marilyn introduces us, and I think there's some amazing work going on. And I think we talk about globalization and interconnection. I think this is what better way than to connect around compassion, be it schools, connecting schools from around the world compassionately around compassion. And again, I say this is not some airy-fairy. This is concrete value proposition. The students' school grades would actually go up if we teach them, if we combine them with the compassionate soft skills along with academic skills. So there is a strong value proposition. That's why I'm really hopeful that we keep on chugging along around the world. Each one of us, we can actually make a dent globally.
I would like to just add that if you want to get involved, you can always get in touch with us, as many hands as possible, in order for this particular initiative to grow. And if you want to take any help from us, if you want our projects to be running in your area, just give us a call. Just send us an email whenever you want.
Thank you for that generous offer.
Okay.
I think people will be taking you up on that.
Sure.
Well, I think we can close for the day, and thank you again so much.
Thank you, guys.
Thank you so
for your
much. Thank you. Appreciate
and
it.
for all of the people who attended and your questions. It's been a really great webinar. Thank you.
Thank you. Thank you.
Thank you. Thank you. God bless. God
Bye-bye.
bless. Thank you. Bye-bye.